So I'm happy to be here to talk to you all about Johnson City Recovery Center and in general recovery community centers. They're kind of called the new kid on the block in the recovery ecosystem. And our preliminary findings are showing that they're super helpful. So I'm excited to talk to you about this today, and we'll go ahead and get started. This is kind of the plan for today. Well, my slides are not advanced. There they go. Okay, I have a number of objectives today. So when I introduce the topic, I'm going to kind of give you the why of why this is an important topic. Then I'm going to talk a little bit about recovery community centers, what they are. We'll look at some of the preliminary findings briefly about recovery community centers in general. I'll talk a minute about peer recovery support services, because that is really where we live as a recovery community center. And then I'm going to spend most of the time talking about our recovery community center in the Tri-Cities, the Johnson City Recovery Center. And I'll refer to that as JCRC throughout the presentation. And I want to just give you a heads up that I am not well. I'm kind of sick right now. So I'm not at my best, but I am here present as best as I can be. So I apologize if I fumble a little bit. All right, well, let's get started. Let's look at the why this is important. Well, I think you would have to be living under a rock over the last decade to be unaware of the overdose epidemic and the opioid epidemic in our country. What's happening is, unfortunately, the overdose mortality rate is not decreasing. In fact, in 2022 and 2021, 2022, it's remained about the same. And that is somewhere around 110,000 people dying annually in our country as a direct result of unintentional drug poisoning or overdose. About 75% of those are opioid related. Now, what I'd like to do next is talk a little bit about, excuse me, I gave you 2022, 2023 data there, and I'm ahead of myself. So it's 2021, 2022, but 2023 is predicted to be over 110,000 deaths as well. And since the opioid epidemic began, we've lost over 1 million people to drug overdoses. Everybody is affected at this point in time. Nobody, almost every time I do a presentation, I usually ask, how many folks that are in attendance have lost somebody or know somebody that has died as a result of an overdose. And nearly 3/4 of the hands are raised. So I think everybody in our country is affected in one way or another at this point. So let's look a little closer at Tennessee data. And as you can see, we are following the same trajectory, that the overdose deaths do not appear to be decreasing here at 2023 from really about the start of the pandemic until now. We're seeing stable rates, which is really scary. And a lot of this is most of this is due to fentanyl and fentanyl analogs. So what we've seen in Tennessee is that there were about 3,800 overdose deaths reported. Now, I just need to say that these are usually underestimates, because not on all death certificates even if they are overdose related deaths, it may not be reported as an overdose. It may be reported as something else. So these are definitely underestimates. There are the predicted number is 39, a little over 3,900 for 2023. Now, so those are just the reported and predicted values of actual overdoses, fatal overdoses. But the number of non-fatal overdoses is estimated somewhere around 30,000. And again, that's probably a significant underestimate. Now, in our region, particularly Carter County, Washington County, and Sullivan counties, in 2021, we lost 158 community members as a result of a fatal overdose, and that's 2021. So I don't have the up-to-date data at this point. That comes from the Tennessee overdose dashboard. So that's something accessible to everybody if you're interested, but they didn't have an updated count when I developed the presentation. So what we know in 2021 is that about 220 people a day die from a opioid overdose. Just let that sink in a minute. 220 people daily die from opioid overdoses. So so the opioid epidemic, the prescription drug epidemic began somewhere, 1999, 2000, when we started becoming really aware that something was going on, that we were seeing overdoses increase significantly. And we knew that system transformation needed to occur. So what that means is that we started to move from an acute care model of care and treatment to a chronic care model or recovery and wellness model of care and treatment. And so the whole system transformed somewhere in the mid-2000s. So SAMHSA, the Substance Abuse Mental Health and Services Administration, and the Center for Substance Abuse Treatment got together with a lot of experts and research institutions around the country and developed this model of recovery-oriented systems of care, where, again, we really began to look at micro, meso, and macro systems and how we can kind of move to a recovery management. So, we used to think in terms of someone either had a substance use disorder or not. And once they went to 30-day treatment program, they were going to be fine. Well, we know different now. That's not the nature of addiction. The nature of addiction is that it does tend to be a chronic condition. People do recover, but it tends to take 2 to 5 recovery attempts before someone is able to land in that place of sustained remission. And that's information from studies from the National Recovery Institute out of Harvard, that people do recover, and recovery really is likely if all the recovery supports are in place. And that's what these recovery-oriented systems of care do, is they provide all these wraparound supports to help build recovery capital. And recovery capital are all those things in an individual's life and the family's life and the community that help to nurture and support recovery, so that that recovery is not only likely, that it's possible. If folks have safe housing, if they have treatment, if they have proper medications, if they have job opportunities, if policies are supportive, if there's funding opportunities for folks to get the services they need, on and on and on. Recovery is likely. And we can change that myth that, once an addict, always an addict. So what I want to move to talk to you about now is the Recovery Ready Ecosystems model. And why I want to talk about this briefly is that this model built on the recovery-oriented systems of care model and looks at the individual and intrapersonal levels. Things like, think about Maslow's hierarchy of needs. That's really kind of at the center of this, that if folks have a sense of agency, self-efficacy, self-esteem, that they have a reason for living, purpose, belonging, a willingness to engage in the community, that and that they contribute. I see in my work that one of the things that supports recovery as much as anything else is volunteerism. So here at our center at JCRC, folks have an opportunity to volunteer, and that helps to nurture that sense of belonging and purpose. And then at the community level, education, employment opportunities, safe housing, recovery support services, and recovery community organizations like ours. That, one of the cool things that has happened over the last 20 years is the integration of recovery support services. And what those are they're services that support recovery management, not necessarily clinical or treatment services, but services that are guided by those with lived experience, peer recovery support specialists. So we know that there's, decades of research on the efficacy of mutual aid support. Alcoholics Anonymous, Narcotics Anonymous, Smart Recovery, Wellbrighty. And there was this a very rigorous systematic review that was published in 2020 about the efficacy of 12-step recovery programs, specifically Alcoholics Anonymous. And the efficacy is just incredible in those models, that the 12-step oriented, and I'm going to move beyond 12-step in just a minute, the 12-step oriented services and supports were just as effective as our gold standard interventions like CBT, and in some cases with some variables, even more so. But what we're seeing is that the next largest mutual aid organization, Smart Recovery, self-management and recovery training, Women for Sobriety, some of the other mutual aid support groups, the mechanisms of change are all similar across all the organizations. So there's no reason to think that these findings in this systematic review won't transfer. And there's been one study that's really compared that compared 3 organizations, 12-step, Smart, and Women for Sobriety, I believe, and found that they, outcomes were similar and just as good. So drawing on what we know from mutual aid support groups and the efficacy of those, we've begun to integrate peer recovery support so that folks with lived experience with addiction and recovery are really at the helm and are integrated into all aspects of the recovery ecosystem. Now, what I want to talk about now is that in our area, specifically the Addiction Science Center here at ETSU, and their colleagues in the region did a recovery ecosystem gap analysis about a year and a half, maybe 2 years ago. I don't think it's been quite 2 years ago. And what they found was that, we were doing pretty good, but there was an absence of recovery community centers. That was the biggest gap in our recovery ecosystem. We did not have one. And really, the recovery community centers are kind of the new kids on the block. I think of recovery community centers as a recovery hub, and they are led and operated by those with lived experience. So I want to talk just a minute about recovery, what a recovery community center is, and then I'm going to talk more specifically about Johnson City Recovery Center that's, right at our back door, and share a little bit of our, our progress. We've been open for about going on 9 months now. But recovery community centers are nonprofit centers for the recovery community that offer local networks of non-medical recovery support centers. And what you'll see is that in the recovery community centers is that, we have people that walk in that are still actively using, and then we have people that participate who have 40 years sustained recovery. So there is room for everybody at the table in a recovery community center. And like I said, recovery community centers, or RCCs, are recovery hubs that are led and operated by people with lived experience with addiction and recovery. So the person with lived experience, that's the voice that's the loudest. And at our center, all of us are in recovery, from, our peer support specialists that, are the daily staff, to me, the executive director, who is in long-term recovery too. So we've all been there, done that. And we're just delighted to talk recovery with anybody that wants to hear it. So we offer peer recovery support services. And what those are, peer support recovery services are characterized by the provision of non-clinical peer support. And that's really the unique element, I think, of peer recovery support services, is that they're non-clinical, and they can include activities that engage, educate, and support the individual as they make the necessary changes to recover from addiction. And like I said, I really think about recovery community centers as recovery hubs, that if we can't provide it here at the Johnson City Recovery Center, we'll find it for you. We'll help folks locate whatever the support is that they need. So these are the kind of things that recovery community centers offer in general. Anything from childcare services, expressive arts groups, maybe legal assistance, technology and internet assistance, mutual aid groups, family support services, Narcan training and distribution. And this list is so not exhaustive. And I'll show you another list too, that from a preliminary study out of Harvard that looked at about 36 recovery community centers in the Northeast, to see what kind of services the centers offered and which ones were rated most highly by the participants. And so they asked participants, or excuse me, the respondents for the survey, I believe they had about 780 valid responses on this survey, but they asked them on a scale of 1 to 7, 1 being not helpful at all, 7 being most helpful, which services were most helpful. And as you can see, when you look at the mean, that everything was pretty darn helpful. And the most helpful, of course, was child care services. And that's can be a huge barrier for recovery for many families. That is not a service, unfortunately, that we offer, but we hope someday that we can do that. It's one of the hardest services too to implement. But you can see that most everything was rated as pretty darn helpful by the participants. And mutual aid groups, recovery support groups, legal assistance, Narcan training and distribution, all of those were rated. I don't think there was anything rated under a 5. So where do the referrals come from for RCCs? Well, most people, almost half, are self-referred. So it's really important to get the word out so that the community knows. And one of the things that we do is we've done, over 50 community outreach events and activities since we've been in existence so that people know that we're here. About 25% of referrals come from treatment, and about 16%, excuse me, come from the criminal justice system. And then other areas that aren't quite as strong are shelters, recovery, housing, and other mutual aid and family, etc. Now, we do tend to receive a lot of referrals from the recovery housing folks here. Now, these pie charts depict the years of recovery of participants and the primary substance used. So as you can see, that almost half of the folks have a year more of sustained recovery. And what's interesting is that, since we've moved to a recovery management kind of a model of care, I mean, that's the majority or half of the folks that we serve that are continuing to attend to support their ongoing recovery. And also, there is this cool thing about mutual aid support and peer support that that by giving back and sharing our own experience, strength, and hope, and in addiction and recovery, that by helping other people, we help ourselves. And in the clinical world, we talk a lot about this as the wounded healer kind of framework. And that is very true, that we have so many folks that are so willing to support the newcomers coming into RCCs. And then the primary substances are alcohol and opioids. Now, this again is in the Northeast. So I think if the survey was conducted in our area in Appalachia, we'd see a much larger slice with methamphetamine. So now I want to move into talking about Johnson City Recovery Center. So JCRC is built on the best and most current science from the Harvard Recovery Research Institute. They are, have totally done an amazing job with science, and not just with the science, but integrating the voices of peers, of people in recovery and people doing the work. They have offered a monthly seminar with the center director, John Kelly, and Laura Hoffman, who's the co-director, and the director of the RCC research arm specifically. And I mean, it has just been amazing. But RCCs are 501c3 nonprofit centers, as we are, led and operated by people with lived experience. Although we don't provide professional or clinical treatment services or recovery housing, what we do is provide linkages to those valuable resources, as well as help to build individual, family, and community recovery capital. And we do this by a number of avenues. We provide a little bit of advocacy training, recovery information, mutual aid support. We have about 17 weekly groups here at JCRC. Recovery and health information, harm reduction. We have naloxone distribution and training available. We have a computer lab, so we offer technology and internet assistance. We help to mobilize resources for the folks that we serve. Employment assistance, recovery coaching, volunteerism. We have yoga for recovery. We also try to do a monthly social activity for folks in recovery as well. So we're a recovery hub, and we offer a safe, supportive, and non-judgmental environment for those seeking recovery. And what's really unique, I think, for us is that we honor, celebrate, and affirm all paths to recovery. And you'll see that when I show you our schedule, that we don't, we have traditional 12-step recovery. We have harm reduction groups and services. We have a well-briety group starting this month. We have a couple of smart recovery groups. So we have a little bit of everything. We have some family groups. But we here at Johnson City Recovery Center, we really don't have any judgment about a person's path to recovery. We just want to support their path to recovery. So that's kind of our deal. So I'm going to share our mission, our vision, and our values so that you know a little bit about who we are and can feel comfortable referring folks here if the need comes. So our mission is to improve the quality for individuals, quality of life for individuals, families, and the communities who've been affected by addiction and substance use disorders in Washington County, but also in the surrounding areas of Northeast Tennessee through the provision of community-based linkages and recovery support services that increase recovery capital and sustained recovery. Boy, that's a mouthful. And then our vision, which is already coming true, is to create a safe, non-judgmental, supportive environment that's led by people with lived experience. And we want all people affected by addiction and substance use disorders to have equitable access to life-saving services and supports. And one way that we do that is that all of our services are free. People don't need to make appointments. In fact, I don't think we've had anybody make an appointment. They can just walk in. There's always a peer available to support them. And our values, we have three primary values: that recovery is possible, and not only is it possible, but it is likely, as long as all the necessary recovery supports are in place. So, as I said, that recovery is likely, and what we know from the data, that most folks do recover, and it might take 2 to 5 recovery attempts to get there, but most folks get there. So just because somebody experiences a return to use doesn't mean that recovery or treatment was a failure. So we've got to let go of that measure of success. We used to measure success by abstinence only. And that is just not an accurate measure, that it often takes, a few steps forward, a couple back, a few more steps forward. Recovery is just not a linear process. 2 to 5 attempts, recovery attempts, and most people will reach a sustained state of remission. That's really hopeful, if you ask me. We also envision a place, a community where all paths to recovery are affirmed and celebrated, that we eliminate the stigma associated, for example, with medication-assisted recovery, that we eliminate all stigma related to addiction, and that people with lived experience are the foundation of what we do. So what I want to do now is just share. I hope you can see this. This is our September calendar. So we have about 17, I believe, weekly groups right now. And I think we have 4 monthly groups. So there's something for everybody. Like I said, all of our services are free, and we are 100% donation, grant, fundraising based. So a lot of our, actually the bulk of our money, funding, came from a grant that I wrote last year for to Washington County for the Baby Doe litigation settlement funds, and we received a $1.2 million grant to start JCRC, which is just such a miracle. I can't even, we have come so far that it is just amazing that recovery support services are valued so highly in our community, and that our county commissioners are progressive thinkers, So it was really just amazing that they believed in this project and funded us so well. So we, from that grant, we knew that we could, probably sustain JCRC for 5 years from the grant alone. But how are we going to sustain ourselves moving forward? So some of the things that we're doing are groups. All of our groups kind of pass the basket and donate, usually on a monthly basis, to JCRC. We've just implemented peer recovery support specialist trainings. So we have some continuing education opportunities, specifically for peer recovery support specialists, but anybody else in the community, clinicians, MDs, nurses, are welcome to attend, and they're pretty low cost. So we do those once a month on a Friday afternoon, 1:30 to 5, and they're $25. And if you do all four, your fourth is only $10. So if you want to support JCRC, all the funding goes to help us stay open. So that's one way. We also get donations here and there. We have quite a few people doing donations or doing Facebook fundraisers. Who knew? That's been bringing in some nice donations for us. And anybody, of course, can donate. And then we do a monthly fundraiser that's kind of a fun thing. You'll see on the calendar, we have a cookout planned for National Recovery Month. September is National Recovery Month, and we will be cooking out hamburgers and hot dogs and have a speaker. And then we have our monthly game night, which is something we've been doing that's a blast, where we play board games and cornhole and all kinds of stuff sober. So folks get to really experience some sober fun, and it's a blast. So this is where we are now. We also do naloxone distribution. So if you need any naloxone, come see us. We can give folks a limited amount. And we have a naloxone box outside of the center in case folks don't want to come in or they need it on the weekend, they can help themselves. So that's kind of a cool thing that we just, I think we had that installed in June. And it's really been a useful part of what we do. So this is us. We are at 513 East Unaka Avenue. And here's our phone number, Facebook, website, and um, and you are so welcome to just stop by. We're open. We have kind of odd hours. We're open from 11 a.m. to 9 p.m. So I said that we are a safe, supportive space for people in recovery. So people can come in and just hang out, have a cup of coffee with a friend in recovery. They can come if they're, struggling, they can walk in and one of us is always there to support. One of the things we're seeing start to happen is that folks want to rent our space if they're having community meetings, or if they want to meet. We're seeing folks like in the 12-step community, if a sponsor and a sponsee want to meet and do some recovery work together, they come in and use one of our spaces to meet privately. So, gosh, come see us and please share our information. This is who we are. So this is a picture of the JCRC crew in front of our sign. And then probably our most sought after peer recovery support specialist is Trudy Blue. She is our emotional support dog. And she is a mini Bernie doodle and she loves everyone. So if she is not here, I probably have 10 questions a day. Where's Trudy Blue? And so everybody loves Trudy. And I think that is it for me. And we've got plenty of time for questions. So I'm going to go ahead and stop sharing my screen so I can see you all. And if anybody has questions, I'd love to field those. Andrea has her hand up.
Hey, Dottie.
Hi.
Hi. I don't really speak very often, although first off, with Zoom meetings because I get real nervous, but so
I
I
feel you.
apologize.
Me too.
But first off, Dottie, thank you for your presentation today. This is, oh my gosh, like I want to cry. This is remarkable. I'm a recovering addict and alcoholic. I got sober up in Maine. I've been sober for 8 years. And this
Ooh,
is what they had up there in
yeah,
Maine.
yeah, yeah,
This
yeah.
community, this sobriety, this is just amazing. And like, oh, I'm shaking. Like, this is just, oh my gosh.
Oh,
Like, thank you
come join
guys.
our community. We need everybody.
Golly, thank you so much. Because, yeah, like addicts and alcoholics are not a lost cause. Our paths are not linear to recovery. And you do have to give it away to keep it. You do have to do that community service or working with another addict or alcoholic. So, like, this is just, and all the, how involved you guys are. Oh my goodness. Thank you. Just thank you. This is so important for East Tennessee in particular in our community with the opioids and fentanyl and everything going on right now. It's just sad. So, to have this safe space in our community, truly a blessing. Absolutely. And
Well,
that's
I'm going to be looking for you to come visit us.
but that's all I got to say. Thank you guys.
Any other questions or comments?
And you
I'm
don't
not
have to raise your hand. You can just start talking
sure.
also if you wanted to. Um, so yeah.
Oh, one of the things I did want to say, I forgot to share, is that we officially opened January 3rd of this month. And through all of our groups and events that we've had so far, we've seen over 3,500 people in and out of our groups. And our best estimate for unique individuals is around 900. And one of the things that we do that is very unique compared to clinical services is that folks, if they want to remain anonymous, they can remain anonymous. So if they don't want to sign in, create a profile, they don't have to. We want people to feel safe. Now, we do encourage that and say, numbers, it really helps us if you do for our potential funders, but nobody has to. So it does make it a little tricky, but our best guess, our data person has come up with, and that's a conservative estimate. So, but we think that we're reaching folks. We'd still like to see, one of the areas that we'd like to see more is our walk-ins. We're starting to see our walk-ins pick up. Our groups are definitely, our groups and our monthly social activity are definitely the highlights. Oh, and we have a grief and loss support group for folks that have lost somebody to or in addiction. And that's a monthly group. And it occurs the first Monday of each month. And that's led by Amy Probst, who is a LMSW MDiv and who is the partner of a person in long-term recovery. So that's been, we have definitely seen the value of that group. And it's amazing. So those are some of the highlights, but we'd love to see our walk-ins. And, like I said, no appointments are necessary. And folks can make an appointment if they want, but they can just, walk right in, use the space, make themselves at home. We have TVs, coffee brewing all the time. It's not very good usually. Who makes it around here, but we always, we just want folks to come in and feel supported and welcomed. Anybody else? Oh, Jesse, great. Come see us.
I kind of want to know, I love JCRC, and I want to know, like, what's been, because I was there whenever I was working at Ballot as a CPRS, and then I came and I did the meetings there or whatever, and so I've kind of been there like since you guys have opened, and I'm wondering what has been the most surprising for you, like since you've opened, like what has been the most surprising things that have happened thus far?
Well, I can answer that pretty easy. And I think the most surprising piece for me has been the acceptance of multiple paths to recovery. I have been in the addiction treatment recovery field nearly 40 years now. So I have a lot of history and have seen, tremendous change and progress. But, it has been pretty dominated by 12-step and 30-day treatment. And so I think a lot of that, we haven't gotten any flack, for offering harm reduction, traditional 12 steps, SMART. I mean, we've gotten no flack. And we've also gotten no flack for our naloxone distribution box in the community. I mean, none. I expected police or the county or the city or somebody, because we just kind of said, there's not any county or city officials on here. But I just kind of said, well, I don't think I'm going to ask permission. I'd rather ask forgiveness, and we just kind of did it based on what Carter County did. And we haven't had one person. I mean, I was expecting some NIMBY kind of stuff. Plus, I mean, our community where we're located. I mean, we just haven't had any opposition. And I think that that's a real testament to, everybody's affected now.
Yeah.
Everybody's affected. So, yeah, those are the kind of things that have surprised me in a good way.
Thank you. Yeah, that's what I mean. I was hoping that you would give me the positive surprise.
Yeah. Anybody else? Going once? Going twice? All right. Well, if you have any questions, feel free to email, call, or better yet, come by between 11 a.m. and 9 p.m. We would love to have you visit and see who we are. Yeah, and you can meet all our peer recovery support specialists and fall in love with Trudy Blue like everybody else.
Thank you so much for coming today, Dr. Greene. This was really enlightening and a wonderful, wonderful presentation. So bravo. And for everyone who came in late, we will be posting the recording of this on the WGS website. And please, before you sign off, if you were joining us looking for credit, send in the chat your name and which class you were looking for credit for. And thank you again, Dr. Greene. Just couldn't have been a better presentation.
Thank you.
All right.
Yes,
thank you
this
so
was
much.
great. It was so good. I hope you feel better soon.
Thank you so much.
Yeah.
Bye-bye.
Yes, no kidding.
Bye.
Yeah, get well soon. Thank you for taking the time.
Sure. Bye.
Thank you. Bye-bye.